Hi everyone, welcome back to Forward Therapy. My name is Kelly Troutman. I'm a certified hand therapist. And in today's video, I just want to go through some scar mobilization techniques on an actual scar. So as you may know, if you've watched any of my past videos, I recently had foot surgery. I had a bunionectomy on my left foot. So obviously this is a hand therapy channel, but I figured, hey, while I have an actual physical scar that I can show you, why don't I show you guys some actual scar mobilization techniques instead of using just like a line Sharpie drawn on my hand. So let's get into it. Right, so again, imagine that this is a hand and not a foot, but this technique works on scars anywhere in the body. Excuse this like weird texture on my foot. I was wearing this fuzzy sock, and underneath the boot, it just like leaves funny marks on the foot. So sorry if it looks a little bit creepy and crazy right now. But anyway, we're thinking about this little sucker right here, right? This is the scar. So you can kind of see the end points of my scar. It is a little bit thicker over the joint. I'll be honest with you guys, my scar is not looking amazing. I definitely need to get on top of it a little bit better and be more consistent about managing it. But I don't think it looks too bad so far for being 8 weeks out of surgery. But I digress. So let's talk scar massage, right? 3 times a day for 5 minutes. It is a really good idea to come in with the other hand, this is my foot, with any finger or hand that you have available, and move the skin gently. So see, I'm not touching so lightly, it doesn't move, but I'm not pushing really firmly. Just gentle. Enough to get the movement on the skin, and you want to do that all along the whole scar. So you can do that in circles, counterclockwise, you can go clockwise, but just see how I'm moving that skin around, and this is not painful. Then you can go kind of side to side. I like to do a little bit of shift in the scar too, because we find that there's often spots where there's a little bit of adherence or sticking. And so you can go kind of right to left to right, shifting the scar a little bit. You can shift it up and down, side to side. Anything you can do to get that skin moving. So doing light massage like this, rubbing, is not enough. It needs to be deep enough that the skin moves. So hopefully you can kind of see that okay. And I'm just looking to see if I have any spots that are a little bit stuck where I could kind of show you guys. But to be honest, it's actually pretty moving pretty good. I did have some sticking going on this part of the scar, but it actually kind of has resolved, which is good. That means even though I haven't been doing the best work I could do with scar massage, at least I've been doing some. Now, the other thing that I think can be really helpful, and something that I need to be a little more consistent about using, are scar silicone sheets. So usually you can get these online or at any pharmacy. There's lots of different brands out there. This one, I'm just gonna cut, it comes in like a sheet, a sticker. So I'm just gonna cut a little piece just so you guys can see. And you really only need enough to fit over the scar. I just do a thicker piece because it tends to fall off in my sock pretty easily. And then I just peel back the sticker. And don't struggle with it as much as I'm struggling with it. So I just peel the sticker off like that. And then I just stick it down right on top. Just like that. And don't put any lotion on the skin first. It'll stick a lot better. Leave it on at nighttime when you're sleeping. And then in the morning, you can just peel it off. And they're actually reusable for several nights. So, which is good because the stuff is pretty expensive. So don't waste your money, you know, grab the big piece and then stick the little piece back to it, and you can use that for several nights. Just make sure that your doctor approves of you using that silicone gel sheets, and that your doctor approves of you doing scar massage. Yeah, I hope that video was helpful. If you enjoyed it, please give it a thumbs up, and don't forget to subscribe to Forward Therapy.